Do you give recommendations, or how does that? I'm assuming costs go up as you go into these, but then it's obviously typically, like you said, less treatment. So.
Yes. There's a lot of factors that go into it. First off, I'll say that dextrose does not work well for discs. If you said that's the only thing I'll do, I would refer you to another provider, because I just don't think that that's going to be really that helpful if that is what is going on where we have a disc problem.
I'm kind of the type of person that's like, let's do what's going to be most effective.
Yep.
Rather than keep trying something that may not be. So.
Right. Totally fair. So the discussion between, let's say, PRP and the bone marrow or the adipose, it comes down to the severity of tissue damage as one thing. So an example is, if this is actually a really large tear in your disc, it's probably going to take something stronger, or it will take something that is not as strong but done more frequently over time. So an example is a hypothetical. This is a rather large annular fissure, and we're having the discussion on a bone marrow and or adipose procedure. It's not a hard and fast rule that because that's my recommendation, that's what you have to do. Meaning, because both the PRP and the cellular therapies are trying to accomplish the same thing, the difference really is just strength. There's a wide range, but it's all a graded system. One of the examples that I'll use sometime is, if your goal is to go out on a Friday night and get drunk, and I don't know if you drink alcohol, but just we'll play this hypothetical. If your goal is to go get drunk, you could either do that by drinking a lot of Bud Lights, or you could do that by taking shots of whiskey, but just having a lot less. The end result is still going to be the same. It's just a different path to get there. That's kind of the basic framework. But then once we do the physical exam and review your imaging, that's where I can then start to make really more specific indications. Meaning, if this is really mild, and based on my clinical experience, I think you do really well with PRP, and maybe you would need a second treatment, but maybe not, then I'll recommend PRP, because that's going to save you money in the long run. And if we don't need to do a stem cell procedure to really get the effect we're looking for, then I'll be honest with you about that. I care more about my reputation than I do about making money.